I think revision breast augmentation comes in two groups. The first group are patients who had breast surgery and haven't been happy with their breast surgery. Those are challenging patients because they're coming in for help, but I never saw what they looked like originally. And their expectations are still very high because their expectations were never met. The second group of patients who come in may have had implants in for a long time and their body has changed. And they were originally very happy, but they're not the same person. And the changes are oftentimes gradual. And so we have to sort of reestablish where they are. I think it's a great time because there are more choices for patients. We do a lot of dimensional planning, we do 3D imaging, I can see what their chest wall is like. Many of the patients that come to see me now after a long time originally had saline implants. And size for size, the saline implants are typically a little bit heavier. They don't feel quite as natural as the gel implants today. So I'm quite comfortable, at least at the very basics, switching from saline to silicone because I've never had a patient who had saline switch to silicone and like their salines better. So I know right offhand I've got an opportunity to make a change that's better for them. In addition, today we have more size choices so we can fine-tune it a little bit better. But what's remarkably different and what's remarkably better is for the patient who's had implants for a long time but doesn't want their implants anymore, we have the option of using their own fat, what we call a simultaneous implant exchange for fat, or a SEEF operation. There are many patients, and one of the most important questions I ask them were you originally happy with your breast implants? Because if they were, it means their body's changed, but their goals are different. And many of those patients will do well without their implants and have the addition of a little fat. Some even have implants out, a little bit of fat, and a breast lift. We have many more choices for those women today.